Hey everyone, I'm here to do my 1 month update after I've had surgery for thoracic outlet syndrome. I had surgery at the Mayo Clinic on January 21st, 2020, and today is February 21st, 2020. So we are exactly 1 month out after surgery. So here are some updates. I've already had physical therapy. I started at the 2-week mark, and I've already had about 5 sessions. And I've noticed my progression has been getting better, but the muscles are definitely weak. So keep in mind that if you've had thoracic outlet syndrome for a while, and if you've been symptomatic for, I would say, more than a year, you need to realize that the recovery process is going to take some time. It's not going to be an overnight fix, but it will definitely improve. So one thing I was having issues before when I had therapy beforehand was I did not have full range of motion as far as being able to turn my head. So normally you should be able to turn your head all the way to the right, all the way to the left, like you're looking over your shoulder, and be able to lift your head all the way up without pain, and then bring your chin all the way down to your chest. So as you can see, that has definitely improved. I was maybe about 70 or 80% to the left side where I can actually turn, and then I would have to really try. Now I can move it around, no problems. I haven't had any issues with numbness or tingling in my arm, unless like I sleep on my arm and I do something like that, but that will happen to everybody. What I have noticed is that when I'm doing the targeted exercises for thoracic outlet syndrome, I am still very weak. So if you haven't had surgery yet and you're kind of inquiring about what they do, what I had done was transaxillary rib resection with scalenectomy. So this is my left side. I know it's probably showing on a different side for you, but they cut right here under the arm, and then they went inside and took out my first rib. So I didn't have an extra cervical rib, but they took out my first rib to open up the area where the nerve bundle goes to give it more space to decompress. And then when they went in, they found a whole bunch of scar tissue on the inside. So they had to kind of open up those muscles, remove the scar tissue, and go in. So if you think about it, there was a lot of, not just the scarring, but there's a lot of internal healing that's going on. Plus, we're moving around muscles and kind of cleaning up. It's going to take a long time to repair that. So this muscle gets sore or it gets fatigued very easily. And so it'll start kind of maybe like when you work out, like kind of like a dull ache that's in there. But if you don't take care of it, it'll get worse. So I feel pain here, and then it'll translate to the back. And then if it gets really bad, it'll kind of travel through my shoulder and kind of go down my arm. Not numbness or tingling, but it's still pain. And that's more if I'm trying to do too much stuff. I'm trying to move too fast. I'm trying to carry something too heavy, and I've gone beyond my limits. Good thing is that I've been able to manage the pain with ibuprofen and or Tylenol. When it's really bad, I'll do maybe 600 milligrams of ibuprofen with 1 or 2 500 milligram tablets of Tylenol. That's when it's really bad. Otherwise, if I know it's kind of bad, I may just take the ibuprofen, or I may just take the Tylenol. If you are particularly sensitive in your stomach, be careful when you take ibuprofen. Always make sure you take it with food. Otherwise, you can have a lot of GI or stomach upset. That being said, along with this soreness, when we're doing the evaluation for physical therapy, we also found out that my back muscles are very weak. So we're talking about, you have your shoulder blade. So let's say if we're looking from the back, shoulder blade, this is your spine. Those muscles right there next to the spine are very weak. So we've actually been doing some exercises similar to a rowing position, and they'll put minimal weight, like 2 pounds, or I think we've tried up to 5 pounds, but it's kind of hard, and just kind of focusing on bringing it across, and then at the very end, making sure to tuck in my chin so I'm not overextending my neck, bringing in the chin, and then doing a little squeeze in the back, and then bringing it forward. Along with doing those exercises, I also noticed, because I had issues with thoracic outlet syndrome for over 2 years before I had the surgery, a lot of my other muscles have had to compensate to make up for it. So the issue is going along here with the nerves. So my back muscles, right along where the shoulder blades are, the scapula are very weak. Well, I started arching my lower back. So instead of you have your normal spine curvature, I would curve my lower back to be able to compensate. And then I would also make my ab muscles very weak by doing that. So when doing their exercises, whenever you're doing stretching and opening up, you need to make sure that you're also focusing on correct posture. So I have to think about it in a very procedural way, where I'll have to, before I make the motion, I'll have to tuck in my chin, tighten up my abs, and then do the motion. It takes a lot longer, but I'd rather do it the right way to be able to prevent any other issues. And really, if I have a weak core, the only way that it's really going to get fixed is if I start exercising. So I know that I need to start doing some ab work, core work, and some cardio work as well. One thing they did recommend is, if you are working out, don't work out the front more than your back. You need to do something that targets the back as well. If you do too much here, and I already have some like pec minor tightness and some tightness in here, if I keep on working out this, and this, it's going to tighten up too much and cause more pain. So if you're doing any workouts that have use of your chest muscles, you have to do at least equal amount toward the back, or more so, to strengthen your back. So I know I'm looking into doing some yoga exercising, as well as I need to start doing some cardio. I know for the ab workouts, they said try not to do crunches because you could put a lot of stress on your neck. And I know I had a lot of issues with neck pain in the past because of this. So maybe doing like reverse crunches. I did one during PT where I took kind of like a medicine ball and focused on bringing in my chin and then bringing it overhead and then bringing it ahead while lying down. So there's a lot of exercises like that that can help. But so far, 1 month out, I would say definitely the surgery was worth it. I've already noticed, the numbness is gone. The pain is decreased tremendously. It's more about gauging my abilities to do normal activities and making sure I listen to my body when I'm running out of energy or running out of strength in that muscle. Another issue that I did have was issues with breathing. So we found out after I had surgery is that if I'm overexerting myself, these muscles start to cramp up and have pain, and then my body will guard from using like the full extension, and I would have trouble catching my breath. So I started using something that they call on Amazon called the breather, and it's actually helping you with your respiration, both inspiration, breathing in, and expiration muscles. And I also found out that beyond the diaphragm is the main way that you breathe, but the scalene muscles are also accessory muscles for breathing. So what I was noticing in issues, I'm a singer, so I sing various times a week. We get called for events and stuff with our group, and I noticed that if I was in any type of pain, I would have trouble catching a breath. So I knew diaphragmatic breathing really well, breathing in kind of like from your stomach, but I still felt like I didn't have enough support up here to catch a breath. So I felt winded. I felt like I couldn't breathe. So I had to really make sure I focused so I wasn't getting anxious because of it. One thing that did help though is if I had to sing or if I needed to catch my breath, I would anchor my hands on my legs or on a firm surface to kind of brace, and it kind of helped give some support for me to be able to breathe. If you're having issues with it though, make sure that you get one of those breathing exercise machines in the hospital and start using it then. If you don't know how to do diaphragmatic breathing, there's lots of YouTube links on it. If you can even find breathing for singers, and that'll help you as well. And it'll help kind of project. I've also noticed that if I started fatiguing and I wasn't breathing right, then my muscles in my neck started fatigue, and then I started straining while I was singing and I was getting hoarse. So all of that affects, even if you're not a singer or anything like that, it can make your voice go very hoarse just because of the strain. I was noticing even with just regular conversation that if I was having a normal conversation with someone for more than 5 minutes, I would get winded and I would have to stop or catch my breath before I could go. So if you're having issues with that, it's not the end of the world. You still want to get checked out, get a chest x-ray done if it's very, very severe. But if everything's clear, just make sure you're doing breathing exercises to make sure it gets fixed. Otherwise, I have been ecstatic about my progress. Yes, it kind of holds you back for the meantime within that. I mean, I'm a month out. I'm still on like disability leave just because I know I wouldn't be able to sit at a computer for hours at a time. In my work environment, I wouldn't be able to travel and do that stuff. I wouldn't be able to lug around a laptop and a work bag. So for right now, I still feel that I'm still not in the best shape to go back to work, but I'm well enough to be able to drive for short distances, or if I need to grab some food. Groceries, I have not attempted to use a shopping cart. When I've tried to push something like that, it still feels like too much. But if you have like online grocery pickup, that's probably the best thing for you. That's what I've been having to do. And then I have my son being able to help me bring the groceries in. And then once they're in the house, I can kind of work from on the floor, from the counter, and be able to put them away. I've been able to cook. I try to find some shortcuts if I can, some pre-cut stuff, but I was still able to hold the pan and cook, which before I wasn't able to. I still can't pick up super, super heavy pans, but it's definitely an improvement compared to where I was. So I hope that this video has been helpful for those that are considering having surgery. My opinion, so far it's been worth it. Of course, I'm doing physical therapy to be able to prevent having a recurrence of symptoms within the next 5 years, which they say it is a possibility, but with physical therapy and surgery, the success rate goes up to 85% with little to no chances of recurrence within 5 years. So this is a slow recovery process, or a slower recovery process than expected, but I would much rather take it slow and steady to be able to have a vibrant, healthy life ahead where I can get back into an exercise routine, being able to cook my own food, and more of into a healthy lifestyle. If you have any questions about anything else that I've gone through in this first month after surgery, feel free to leave me a comment. Make sure to like the video, subscribe. I will be doing more update videos. I know I was trying to do it every week. I had something that came up last week. We had a death in the family, so I wasn't able to do a video, but I still thought it was fitting to be able to do my 1 month update. So I hope you enjoyed it. Stay tuned. I'll keep you updated on anything else that may be a barrier or some good takeaways as you're going through the process. Thanks. Have a good one.